I am here to talk to you a little bit about crowns. Hi, my name is Dr. Dustin Lee from Dental Designs Clinic. The first things first is, what are crowns? Really, they're protective jackets for the teeth that really help to restore teeth that are severely broken down or damaged. Especially if you've either broken a tooth or you've had a large cavity on it, or say that you've just worn down the tooth to the point where it's just not very strong, we'll go ahead and put a crown on it. Once we know that you need a crown, there are several materials that you can end up choosing from. Broadly, there are things like ceramic crowns, which are metal-free. They tend to be really great for patients who have allergies to metals. The two types of ceramic crowns that we use most often are zirconia and lithium disilicate. Zirconia crowns are strong materials, which means that they are very fracture resistant. They tend to be really great for patients who grind their teeth. Because it's so strong, we can also make it relatively thin. When we can make it relatively thin, we don't need to take away as much tooth structure, which ultimately is going to be healthier for you and your tooth. The downside sometimes being is that it's so strong that if you are a grinder and it's grinding up against the natural tooth, sometimes it will cause excessive wear on the opposing tooth. But we will assess that and see whether or not that zirconia crown is actually a good fit for you. The second type that we do is lithium disilicate. Lithium disilicate is a really nice material. It tends to be a little bit more lifelike in appearance than a zirconia crown. The other thing also is that it is bondable. And when that crown is bondable, it means that we glue it onto the tooth. And so we really don't need to require as much tooth structure to be reduced, since we don't need to do a traditional crown prep that holds onto it. The downside of the lithium disilicate is it is a little bit less strong than zirconia. And so because of that, we tend not to use it in situations where maybe there's tons of wear or a history of significant cracking or fracturing. Ceramic crowns, they tend to be very good options, especially if you want a tooth colored restoration. But again, the downside just being that they are a little bit less flexible and a little bit more prone to chipping. Now, if we go to the more kind of traditional materials in dentistry, we've got something like a porcelain-fused-to-metal crown. Those are the types of tooth colored crowns that I was trained on when I was in dental school. I would say they're a little bit more of an old school material and not done as often anymore. But the nice thing about these porcelain-fused-to-metal crowns is, one, you get really good adaptation of the crown to the tooth, which is very, very important in terms of longevity. The other thing also is that it does give you a tooth colored restoration. But again, it's just, I would say, an older technology. Still has its place, but something that we don't do quite as often. The other one that is quite commonly done is gold crowns. They tend to be very, very well fitting to the tooth. They are also very friendly to the neighboring tooth because it is a softer material. It tends to be very, very strong. And we can also thin it out quite a bit, so we don't need to take away as much tooth structure. I would say the main downsides of gold crowns is really just the appearance. Obviously, you're going to have a gold tooth in your mouth rather than something that's tooth colored. The other being that tends to be quite cost prohibitive these days. Obviously, with the price of gold, these crowns can be quite expensive. Here at Dental Designs, I would say a majority of our crowns tend to be zirconia or lithium disilicate. Typically, we use a digital workflow at our office. In order to do that, what we do is we have an intraoral scanner. So it tends to be a very, very fast impression. One of the things that was very, very special about our clinic is we are able to provide same-day crowns. What we do is you come into the office, we work on the tooth, and we scan it. After we're done scanning, you can go ahead and relax, enjoy the rest of your afternoon. Meanwhile, our in-house lab will go ahead and design that crown and custom make it to your tooth. They are able to provide that service and turn it around by the end of the day. And so by the time that you come back in the afternoon, we can go ahead and issue you your crown. So all in all, you'll be able to get a crown start to finish in about a day's time. Thank you very much for hanging around and learning about dental crown materials with me. If you want more information, please visit dentaldesigns.com.sg for more information.